The federal job cuts under President Trump. This time, some 10,000 workers in the Department of Health and Human Services amidst a massive restructuring and the elimination of entire agencies. Catherine Cook's in the newsroom looking into the potential impacts on people in the Northwest. Catherine?
David, tonight the Oregon Health Authority tells us that this will end $117 million in COVID-era grant funding a year before some of those grants were scheduled to end. That funding would have supported substance abuse treatment programs and vaccine-preventable disease work, among many other things.
These cuts, they're reckless. They're very ill thought out.
Scott Palmer is angry over the latest round of federal cuts to Health and Human Services. As chief of staff for the Oregon Nurses Association, Palmer worries about his members, many of whom work in overcrowded emergency departments. And he worries about people across the state whose access to federally qualified health centers may be disrupted because of these cuts.
For example, free maternal care, right? Those folks won't have any place else to turn but the emergency rooms of their local hospitals. And those local hospitals are staffed by ONA members.
Health and Human Services oversees 13 agencies. That includes the Food and Drug Administration, the CDC, and the National Institutes of Health. Cuts announced so far will reduce the department's workforce from 82,000 full-time employees to around 62,000. On X, HHS Secretary Robert F. Kennedy Jr. defended the move.
The U.S. ranks last among 40 developed nations in terms of health, but we spend 2 to 3 times more per capita than those nations. As Secretary, I now understand why all this money is not improving our health. HHS is a sprawling bureaucracy.
Kennedy said HHS would consolidate the 28 divisions in its health department into 15, calling it the Administration for Healthy America.
We're keenly focused on paring away excess administrators while increasing the number of scientists and frontline health providers so that we can do a better job for the American people.
Unsurprisingly, these anti-vaxxers are slashing vaccine research, and at the very same time dedicating resources to launch vaccine conspiracy investigations and resurrect debunked science.
On Thursday, Washington Senator Patty Murray slammed the Trump administration's latest cuts. She noted the nation's growing number of measles outbreaks and warned of other potential consequences the cuts may have on public health.
They are picking chaos, plague, and pandemonium. That may as well be their official policy because that is what is coming down the tracks if they don't change course.
ONA is calling on Oregon's congressional delegation to oppose these cuts, specifically Republican Cliff Bentz.